It happens to the best of us, right? You wake up after a restless night, stumble into the bathroom, look in the mirror, and boom, there it is, a noticeably puffy, swollen face staring right back at you. Now, if you spend any time on social media, your mind might immediately jump to those viral TikTok videos warning you about cortisol face. You start wondering, wait, is my stressful job or my anxiety literally physically changing the shape of my face? It's a pretty terrifying thought. Well, today, we are going to unpack exactly what's really going on there. Welcome to this explainer for the skin surgeon. I'll be your narrator today, guiding you through a presentation prepared by Dr. Thomas Hocker. He's a Harvard and Mayo Clinic-trained, triple board-certified dermatologist, Mohs surgeon, and dermatopathologist. The information we're covering reflects Dr. Hocker's clinical expertise, and it was medically reviewed for up-to-date accuracy as of July 3, 2026. Now, just a quick disclaimer before we jump in. This explainer is for general education only. It's not personal medical advice, and it doesn't create a doctor-patient relationship. You should absolutely always talk with your own clinician about your personal health. Okay, let's just dive right into this. Is your morning face actually a cortisol warning? Look, it is completely understandable to worry that the everyday stress of modern life is permanently altering your facial structure. Social media gives us this really convenient villain, cortisol, and a satisfyingly simple story to go with it. But, medicine relies on actual patterns, not just viral phrases. So we're going to transition away from that social media anxiety today and step right into clear, objective medical reality. Let's start by busting some of the biggest myths out there. Let's kick things off with our first myth versus medical reality. The myth that a puffy face automatically means you have high cortisol. The medical fact here is that most puffiness is simply not a cortisol disease. You see, cortisol face isn't a real medical diagnosis at all. It's 100% an internet invention. Everyday stress, like, say, a looming deadline at work or an argument with a friend, it simply doesn't raise your body's cortisol high enough or keep it elevated long enough to physically change the structural fat shape of your face. And that leads us right into our next big myth: stress can give me Cushing syndrome. The fact is, everyday stress does not usually cause true Cushing-like facial changes. Cushing syndrome is a very real, well-documented medical condition where sustained, incredibly high cortisol actually does reshape the face. But here's the thing, it is extraordinarily rare. We're talking about it affecting only around 2 to 8 people per million per year. To get there, it requires months, even years, of pathologically high cortisol, not normal emotional strain, and it always comes with other severe full-body symptoms. But because of all this online fear, people understandably turn to these trendy fixes. The myth here is that a so-called cortisol cocktail will fix your face. The hard fact? Absolutely no supplement is proven to fix facial puffiness by lowering your cortisol. Those really expensive electrolyte and magnesium powders you see in your feed, zero evidence for reducing facial swelling. And ingredients heavily marketed online, like ashwagandha, well, they aren't just unproven for your face. They can actually carry real safety risks, including documented cases of severe liver injury. Remember, natural definitely does not always mean safe. All right, myth number 4. If you're taking a medication and you think it's causing facial changes, you should just stop taking it, right? Wrong. The absolute medical fact here is absolutely crucial. Do not stop prescription steroids suddenly. Prescription oral steroids like prednisone are actually the most common real-world cause of true cushingoid facial changes. However, suddenly stopping them without a doctor's strict tapering plan, that can cause an incredibly dangerous, life-threatening crash in your body's hormone levels. Always, always talk to your prescribing clinician first. And our final myth, all facial swelling is harmless. The fact is, while most morning puffiness is completely benign, certain patterns of swelling are actually urgent medical red flags. Think sudden airway swelling, painful eye swelling, hives, dizziness, kidney symptoms, or facial swelling combined with chest symptoms. Those require immediate professional evaluation from a doctor, not a jade roller or a detox drink from the internet. So what is the actual science of what's happening to your face overnight? Honestly, it mostly comes down to basic physics. The tissue around your eyes is incredibly thin. So when you lie completely flat for 7 or 8 hours, gravity shifts fluid from your lower body directly up into your head and face. Add in a salty dinner, which makes your body hold on to extra water, or alcohol, which causes rebound water retention and widens your blood vessels. Throw in poor sleep, normal hormonal fluctuations, seasonal allergies, or simply the structural changes of just getting older. What you're seeing in the mirror is almost entirely a normal, completely temporary fluid shift. To help you distinguish between that harmless fluid and a real medical issue, Dr. Hocker recommends a super practical tool. You can literally try this tomorrow morning. It's called the 10-second mirror rule. The core concept here is brilliantly simple. If your face looks puffy when you wake up and normal by lunch, think fluid first, not cortisol disease. I want you to remember that 10-second mirror rule. When you stand up and start going about your morning, gravity naturally just drains that temporary fluid right away. True structural fat accumulation, the kind you actually see in severe medical conditions like Cushing syndrome, absolutely does not drain away by lunchtime. Now, I want to be super clear here. This doesn't mean your stress isn't real or that it has zero effect on your appearance. Stress genuinely does a number on your skin. Medical science confirms that psychological stress can severely worsen acne, trigger agonizing flares of eczema and psoriasis, dry out your skin's protective barrier, and significantly slow down how fast your wounds heal. So your stress is highly valid, and its effects on your skin are very real. But again, it just does not cause that permanent, fat-driven facial rounding that TikTok influencers are claiming. To really understand the difference, we have to look at what true moon face actually is. Moon facies is an actual clinical medical term. It describes a very specific pattern of structural fat accumulation in the mid and lower face. And it's caused by prolonged, pathologically elevated cortisol levels that are, frankly, orders of magnitude higher than what a bad night's sleep or a super stressful week at work could ever produce. This really helps us understand what true Cushing syndrome actually looks like. A pathologically rounded face almost never, ever occurs entirely on its own. If someone actually has Cushing syndrome, they're almost always going to present with severe systemic signs. We're talking intense facial redness, really wide purple stretch marks, bruising without any physical trauma, muscle weakness so severe they might actually struggle to just climb a flight of stairs, central weight gain while their arms and legs get thinner, and the sudden onset of things like high blood pressure or diabetes. It's a full-body syndrome, guys, not a cosmetic insecurity. So if you've ruled all that out, and it is just ordinary morning puffiness, what can you actually do about it? Well, here are some simple, evidence-based steps that cost absolutely nothing. First, sleep with your head slightly elevated. Just grab an extra pillow to prevent that overnight gravity fluid shift. Second, reduce your salt intake the evening before. Third, limit your alcohol consumption. And fourth, make sure you treat any underlying seasonal allergies. Seriously, you do not need to buy expensive, unproven serums. Just rely on basic physics and human physiology. However, medicine is all about recognizing when something actually is serious. Here is exactly when you should bypass all the home remedies. If you have lip or tongue swelling and you're having trouble breathing, or if you have swelling with hives and dizziness, you need to call 911 immediately. If you've got painful eye swelling accompanied by a fever or a bulging eye, head straight to the emergency department. If your puffiness is progressively getting worse and you notice something like foaming urine, make sure you see a doctor within a few days. And if you have gradual puffiness accompanied by severe unexplainable fatigue, go see a doctor within a few weeks. Well, we've covered a lot of ground today, separating the biological facts from all that social media fiction. Keep that 10-second mirror rule in your back pocket. If the puffiness clears by lunch, it's just fluid, not a cortisol crisis. Ultimately, it all comes down to this. TikTok can name a worry. Medicine has to sort the pattern. If you are ever truly concerned about changes happening in your body, log off, step away from the supplement aisle, and go consult your doctor. Ask yourself, what pattern is your body actually showing you? Thanks so much for joining this explainer.